tumors than they are in other diseases. And I think that is in large part due to the patient community, patient advocacy, and awareness of this disease, and patients also wanting to try to advance the field. So I think to the extent that we can continue to encourage that and do that, we really are rapidly advancing treatment options for patients.
Thank you.
So as Nancy's question is that there's, Caring for Carcinoid has been sponsoring a bioconsortium, which in fact, Nancy, I'll be talking about that very shortly. So we'll talk all about that.
A quick follow-on to your point there, Matt, is for patients that have been in clinical trials in the past but are considering clinical trials, should they be concerned that participation in one trial could limit their ability to participate in future trials?
I think technically there is that concern. So there may be a few situations where you really do need to think about how you want to sequence what treatments you're getting to maximize the availability of treatments.
That's right.
I would say in most cases it's probably not a huge concern. I guess I would sort of leave it at that, and I guess talk to your doctor about some of the specifics of how that might work.
And so now turning, again, keeping in this track of the more clinical questions, what can a patient do whose carcinoid syndrome is no longer being managed by somatostatin analogs and for whom surgery is not an option?
I think there are a couple options. One is to try to treat the tumor itself with a number of new drugs and other types of treatment that can directly shrink the tumor down, make it smaller. There are also, however, several new compounds being developed in very early stages in clinical trials to try to do exactly that, to take patients who might be refractory and having a lot of flushing or a lot of diarrhea and specifically treat the carcinoid syndrome, which in some cases is really the major problem that people have.
What are those compounds?
They are compounds that target serotonin synthesis. So we saw a slide of serotonin synthesis. One is a tryptophan hydroxylase inhibitor, currently in trials being performed by Lexicon Pharmaceuticals, who I believe are helping sponsor this function.
Yes. We have two representatives in our audience from Lexicon Pharmaceuticals. And this is a question now turning to diagnosis of patients. Should patients be concerned about the levels of radiation that they receive in their diagnostic scans, or even in some of the treatments that involve radiation?
I think that as a patient and as the physician treating a patient, one always has to weigh the benefits and risks versus in any diagnostic or therapeutic study. I think if an X-ray study offers great hope in terms of diagnosis or treatment, and there are some small risks involved with it, then that's a decision that the physician will hopefully counsel every patient on. Again, most of us, when we practice medicine, always do a risk-benefit analysis to make sure that when we do something, a test, a procedure on a patient, that the potential benefit justifies that risk. And, it all depends on the specifics, case by case.
Thank you. And is there any concern, should patients be concerned about sugar in their diets? Oftentimes there is a lot of that speculation that sugar can feed tumors and such.
Well, as it turns, for carcinoid patients, that's probably less so the case because they tend not to take up as much glucose, unlike almost every other type of cancer. And even if you were trying to limit the amount of glucose you took up, your body's blood glucose level is the same or very close to the same because your pancreas and insulin secretion is controlling it. So that's not something you could really manipulate easily without making yourself very sick. But again, for carcinoid patients, this probably is not even a theoretical problem.
Thank you. And final question is, how do the symptoms that a bronchial carcinoid patient would have differ from symptoms that a patient with carcinoids of the intestine would have?
The bronchial carcinoids can cause symptoms in a few different ways, but one of the more common is just because of a local effect. They grow in the lung, and so very often Patients can have problems with coughing or wheezing, not uncommon for people to carry a diagnosis of asthma for many years before the carcinoid is diagnosed. The small intestine carcinoids can also cause local problems, but they're different. It's often cramping, and those sorts of patients frequently will be diagnosed with irritable bowel syndrome for many years before the carcinoid tumor is diagnosed. There's some differences also in terms of the hormone-type symptoms, with the classic carcinoid flushing and diarrhea far more common with intestinal carcinoids than with bronchial carcinoids.
Thank you. Thank you very much to the whole panel, Dr. Leiter, Dr. Shivdashani, Dr. Choi, and Dr. Kalki.